can kind of think about our behavioral health curriculum and in some ways kind of like two components. One piece are the rotations that the residents go through. So every year there's a behavioral health focused rotation that the residents complete. So you have one that happens during your first year, second year, and third year. And those are set up to, in some ways, kind of enhance the skill set of our residents. So like behavioral health training during your first year, the rotation really focuses on understanding the resources internal to our clinic system. So how to get folks connected to psychiatry or for mental health treatment, or kind of what resources we have inside our clinic system. During your second year, a resident would get training and expanding their maybe medication scope of practice. So spending time with a psychiatrist, expanding their expertise and providing medication for substance use disorder. And so you can kind of think about the rotations as a graduated kind of training experience. The other component of our behavioral health training is in some ways just embedded within the day-to-day practice of seeing patients. So both of our Nampa clinics have an integrated behavioral health team that is available to see patients the same day they come in to see their primary care provider, available to do consultation, available to do brief follow-up with patients. And so what that means is that anytime a resident is precepting a patient that they saw in their continuity clinic, there's a mental health provider, a psychologist available to weigh in on different components to consider about that patient's care. So there's a certain amount of training that just happens every day that you're doing clinical work. And I think in many ways, that is actually the training that tends to stick with folks because it's just part of the air you breathe as a resident here.